Everyone remembers those awkward talks in middle school about sex, practicing safe sex, and puberty. Most of us probably just tried to disregard it at the time. Others probably just tried to forget about it as quick as we possibly could. Now that we're getting older and mature, we need to understand the importance of practicing safe sex. The purpose of my speech is to stress the importance of using protection during intercourse. Failing to use protection during intercourse can result in unwanted pregnancies and a variety of STDs. It is my hope that my speech will enlighten the younger generation of the importance of practicing safe sex. The first thing I want to talk to you about is a more mild STD called HPV, also known as human papillomavirus. Most people have human papillomavirus or had human papillomavirus, and they haven't even known it. The mild cases can go away in 8 to 12 months. There are more extreme cases, however, and they can result in genital warts or upper respiratory issues. It is more dangerous in women with low immune systems because that can cause cervical cancer. There is an estimated 12,000 cases of cervical cancer caused by HPV in 1 year. The most severe and life-threatening STD is HIV, also known as human immunodeficiency virus. The CDC, Center for Disease Control, estimates there were 56,000 cases of HIV per year. And in HIV's final stages, it turns into AIDS, acquired immune deficiency syndrome. It makes the human's immune system very weak and susceptible to a lot of diseases. Treatment for AIDS is a drug cocktail which usually involves upwards of 30 separate medications per day. And there's currently no cure for HIV or AIDS. Luckily for all of us, condoms are 95 to 98% efficient in preventing most STDs. Some STDs can come from oral sex. They're slightly less common, but there are methods to prevent STDs from oral sex, such as a dental dam or a condom. Responsible use of a condom and regular blood tests can reduce the chances of you having an STD by a lot. Condoms also serve a dual purpose of preventing unwanted pregnancies. This is useful because 48%, almost half of pregnancies, are unwanted or mistimed. Unwanted or mistimed pregnancies can cause a lot of financial, stressful situations such as forced marriages, to give up a child, and of course abortions. There are other effective birth controls such as pills, rings that go in the uterus, or injections. There is, however, a downside. Prolonged use of the pill can change the natural menstrual cycle, which has negative effects in the long term. And the rings and injections can drastically reduce the estrogen levels, which is not good for the body. The most effective way to prevent STDs and unwanted pregnancies is to abstain from sex and practice Planned Parenthood. Waiting until marriage is the most reliable way to have a disease-free life and having a child when the time is right. Thank you for listening to me. Have a nice day.
How much was that?